This is the last video lecture for Chapter 6, and in this video lecture we're going to go over the different types of muscles, how we name them, and muscle movements. And before we get started, we're going to go over first the 5 golden rules of skeletal muscles. And so with a few exceptions, all skeletal muscles must cross at least one joint. And as you can see here we have a joint and we have this crossing over of a skeletal muscle. The second one is that typically the bulk of a skeletal muscle lies proximal to the joint that is being crossed. And as we see here, majority of the skeletal muscle is proximal. Remember, proximal is closer to the point of origin or attachment site. And so we have most of that over there, part of the humerus. Here, next one, we have all skeletal muscles have at least 2 attachments, the origin and the insertion. And here we have the origin being the bulk of where that muscle is, and then the insertion is the area that it can then once be moved once the origin contracts. So insertion is point of that attachment where a majority of that tendon is going to be found. Fourth golden rule skeletal muscles is that skeletal muscles can only pull and they can never push. And why is it that they can pull? Well, because contraction occurs. As they contract, this appendage is going to come closer to the contraction site. And then finally, the last golden rule we have is that during a contraction, skeletal muscle insertion moves towards the origin. So let's take a pause right now. Look at this brachialis. As this contracts, so let's look at actually how it can follow all of these rules. As it contracts, it's going to move the insertion, area of insertion towards the origin. It also crosses this joint. The bulk of the muscle is found within the proximal or proximal to the joint. So here's our joint. So proximal to our joint. Okay, so we have all of those 5 rules. Now other types of body movements we have flexion, and a flexion decreases the angle of the joint. And so by doing this, it essentially will bring 2 bones closer together, and you'll typically find this in bending your hinge joints like your knee and your elbow, or ball and socket joints like your hip. So bending your hinge joint, like your knee, elbow joints, or your hip. Extension, so here we're flexing, we're decreasing the angle. Here's normal or 90 degrees, we're decreasing that angle. Extension, we're increasing that angle. So if you can imagine going larger than 90 degrees, so we're increasing the angle of the joint, and of course this is pretty much the opposite of flexion. And this is an example is when you straighten out your elbow or your knee, or if you extend beyond 180 degrees, this is called hypertension. So straightening the elbow or knee, and then hyper extension. It's beyond extension. That's beyond 180 degrees. And let's take a few examples of what that looks like in the next slide. And so here we first have flexion. Flexion is decreasing the angle, and here is an example. We'll just say that here's our starting line compared to this angle here. Flexion, we're decreasing this angle. We went from 90 to that 45. Also, if you start back here, you're still decreasing the angle by going forwards. Okay, flexion, we're starting here, anatomical position. We have this nice straight line. Bending of the knee, you're decreasing the angle, so you went from 180, now you're going towards that 90 degrees. Extension is opening up that angle, so if we're starting from our our 90 degree angle, here if our leg first started over here, and we're going back towards this nice straight line, bringing it towards the anterior position. This is extension. We're closing up that angle once more. Hyperextension, this is when we're going to increase our angle more than our 90 or more than how we initially had it. So here is our plane. Earlier we did flexion, we were decreasing our angle. Here was our 90 degrees from here to here. And now we're increasing that, and this is hyperextension, so we're going above our angle that we initially had. Here's another example. Here's our starting point, anatomical position. Okay, looking at closing off this angle, we're putting our head over here. So by doing this, we're decreasing our angle. So here's our angle, here's our original angle. And then finally, hyperextension, this is increasing the angle even more. So from here to here, that's the entire angle. Other types of body rotation movements, we have rotation. And rotation deals with the movement of a bone around its longitudinal axis. This is very common in ball and socket joints. And an example, especially here in our cervical region of our vertebra, is when you move your atlas around the dens of your axis. So when you shake your head no, that's an example of rotation. So the movement of your atlas around the dens of the axis. Okay. Other types of movement, we have abduction, and the way I remember this is the B, because it's kind of like saying bye. You're putting your hands anatomical position, and you're bringing it superiorly. So you're moving of your limb away from your midline. Here's your midline. Oop, I can't draw it. Here's your midline. You're going away from it, and when you do that, what do? You say bye, aloha. And then you have adduction. This is the movement of your limb towards your midline. So you're going back down. And I remember that because D, going down. Okay, and this is the opposite of abduction. The next type of movement is circumduction, and this is a combination of flexion, extension, abduction, and adduction. And so if you Put your arm out to the side and you make nice circles, and this is a combination of all those movements. And because your arm is a ball and socket joint, this is also not far on your arm, but other ball and socket joints as well, so your hip joint, ball and socket. So combination of flexion, extension, abduction, and adduction. And common in ball and socket joints. Now I want you to stick your leg out and then point your toes towards your shin, and this is called dorsiflexion. So lifting your foot so that the superior surface, here's a superior surface, approaches your shin. And this is opposite to plantar flexion, in which case you're going to depress your foot and you point your toes towards the sole of the foot, so towards the floor. So depressing the foot, and pointing your toes. So you're planting the foot towards the sole. Next movements we have inversion. So inversion is turning the foot here. If you stand anatomical, here's other ladies. Other foot. Here's the other helix. Okay, so here you turn the foot medially, and this is inversion, so turning it inwards. And then eversion, you're turning your foot laterally. And I just think of the ways these two, so inversion for in, eversion I think of exit, and so you're going outside, so you turn it laterally, away from your midline. The next special movements deal with our hands, and so what I want you to do is go in anatomical position, and what you're going to do is just face your palms forward. And so when you do this, your forearms rotate laterally so that your palm faces anteriorly. And by doing this, both your radius and your ulna are in this nice parallel position. Now, if you put your body in the what's called supine position, this is when you're laying flat on your back in the anatomical position. So here's flat on your back, anatomical position, legs are facing up, and this is called supine. And I remember that because up. So up, it's in the word supine, and so if you imagine about this for supine, so also facing up, but more really with supination for your arm, it's facing anteriorly. Pronation, this is when you rotate your arms medially, so your palm's going to eventually face posteriorly. And so it's going away from your body. And by doing this, you're going to cross your radius over your ulna, and you're going to form an X. And so crossing over. And as you can see that here, radius and your ulna. And if you look at this for your body in the anatomical position, if you lay flat on your face, face down, so arm, arm, both of your legs. This is called the prone position, in which case you're facing down. Your supine, this is facing up. And I remember that because own, so it kind of looks like the word down in that little segment right over there. Then the last type of special movement we have is opposition, and this is when you move your thumb to touch the tips of other fingers on the same hand. So you can do your thumb to your index, thumb to your middle, thumb to ring, and thumb to pinky. So moving of the thumb to the tips of other fingers on the same hand. Now let's look at the different types of muscles. So we have a prime mover, in which case this is a muscle with a majority of the responsibility for a certain movement. And a great example is our biceps. And our biceps, as we contract our biceps, what happens? Do we increase the angle of our arms? Do we decrease the angle of our arms? What happens? Good. So we're going to decrease the angle of our arms. So biceps are critical for elbow flexion. So muscles with the major responsibility for a movement. And then antagonist, if something's antagonist, it's something that works in opposition. So it's a muscle that works or opposes, works in reverse or opposes a prime mover. And in this case, what is our antagonist to the biceps? We have our triceps. And because our biceps are for elbow flexion, what is opposite to flexion? We have extension. Synergists, these are other types of muscles, and they aid a prime mover in a movement and helps prevent rotation. Okay, so muscles that aid in a movement and helps prevents rotation. And a great example of a synergist is the muscles that stabilize your wrist joint when you make a fist. So we're not going to have any rotation, either supination or pronation. So muscles that stabilize the wrist joint when making a fist. And another one we have, our fixator, or the final one we have, and this will stabilize the origin of a prime mover. So an example of this are those postural muscles that stabilize your vertebral column. And so if you ever want to have that nice posture, they're going to hold you in place. Now, in addition to the different types of muscles, we can name muscles based on their direction, their size, how many origins they have, and many other different ways. So let's take a look at that. And so the first one we just mentioned was the direction of the muscle fibers. So direction of muscle fibers. And a great example is this term rectus. And rectus, what that means, it means straight. And so, okay, so straight. And the great example here we have is the rectus femoris, and that's right over here. So rectus femoris, one of our thigh. And if you notice the striations, it's all in a straight line. Okay. Next type of way we can name muscles is by the size of the muscles. An example for this is the term maximus. So you can have gluteus maximus, gluteus minimus. And so the term maximus in itself means largest. Okay. Another type we have, the way we can name skeletal muscles is by the location of the muscle. And we can have it, for example, our temporal bone. Right in front of our temporal bone, we have the muscle called temporalis. So that's where we know the location of it. So temporalis. And that sits right above, or more superficial, to our temporal bone. And then we can also look at the number of organs. And remember, in our last rule of 5, our rules of all skeletal muscles, we must have 2 points at the minimum. We must have an origin and an insertion, but sometimes we can have more than one origin. And an example of this are triceps. So if you think of your triceps, instead of having just one origin, they have tri, meaning 3, so 3 heads or 3 origin points. Now, another way we can look at naming skeletal muscles by the location of the muscle's origin and the insertion. Here we have sterno, and so the term sterno, as an example, means on the sternum. And so a muscle you'll see is sternocleidomastoid, and that one deals with the sternum. So we have some insertion and some interaction with the sternum. And also the shape of the muscle. So an example is deltoid, which is a triangular shape, and that's this muscle over here. So it's this nice triangular shape. And then finally, by the action of the muscle itself. And we just went over those different types of actions. So whether it's going to flex, if it's going to extend. Oops. And so here we have extensor digitorum longus. And what does that do? Extensor digitorum. So that's one within our fingers. So it's going to extend our fingers. Now we're going to take a look at the different types of head and neck muscles, starting here with our facial muscles, everything here in green. And first we have is the frontalis. And the frontalis, what this does is it raises the eyebrows as it contracts. Next we have the orbicularis oculi, and this is going to close your eyes, helps you also squint, blink, and wink your eyes, so all your movements of your eyes. Zygomaticus, that's this muscle over here, and this muscle over here. Zygomaticus will raise the corners of your mouth. And then you have the buccinator, this muscle over here. This is going to help flatten out your cheeks and also help when you chew. So as you chew, opening and closing of your cheeks. Then here you have the orbicularis oris, and so I want you to make a note. Here we have orbicularis, orbicularis oculi deals with your eyes, oris deals with your mouth. And this is going to help close your mouth and protrude your lips. Okay, so I'll give you some moment to type all those notes out. Now let's move on to the chewing muscles. And so for this we have the temporalis, and remember when we named muscles, it also deals with a location. Here we have the temporal bone, and right up here is the temporalis. It sits right above that temporal bone. And so this is a synergist of the masseter, in which case it will help close the jaw. Okay. And then we have here the masseter, these muscles over here, and this will help close the jaw and elevate your mandible. So here's the mandible bone. As this contracts, you notice it's going to bring in these bones closer towards each other. Finally, we have within our neck sternocleidomastoid. And if you see the sternal, remember that one of this is going to innervate is the sternum. And this is going to help flex the neck and rotate the head. And so if this contracts, we're going to start shortening all these sarcomeres. Which direction is its head going to rotate? Is it going to rotate to the right or rotate to the left? Good. This one is going to rotate towards the left. This is going to start shortening. Therefore, it's going to bring it closer towards this direction. Platysma, this is going to pull the corners of your mouth inferiorly. Here's the platysma, which you can't really see how it connects in this direction. But it's going to pull the mouth inferiorly. Next, we're looking at anterior muscles of the trunk, shoulder, and the arm. And the one that we're only looking at here is going to be the pectoralis major. And because we see a major, we know that there's two different types. There's also going to be a minor, which sits right underneath. And what this is going to do is going to adduct. So I'll just write the word adduct so you don't get confused with abduct. Adduct and flexes the humerus. So when this contracts, humerus, it's going to be brought back closer towards our midline. The next set of anterior muscles we were looking at are the intercostal muscles, and these are all the muscles that lie between our ribs. So there's two different types with two different purposes. First, we have the external intercostal muscles. These are the ones lying more external or more lateral, and these ones are going to be used as they contract for raising the rib cage during inhalation. And here, as these contract, these are going to get brought closer towards each other, opening up that thoracic cavity even further. Internal intercostal muscles, this is for depressing the rib cage and to move air out of the lungs when you exhale forcibly. And so here we have contraction. Here's the internal intercostal muscles more medially. And if you imagine as they contract, they're going to shorten up, decrease this area and space over here, bringing the thoracic cavity or depressing the thoracic cavity even further. So depresses that rib cage. Oops. To move air out of the lungs when you exhale forcibly. And we're going to see this again in chapter 13 when we go over the respiratory system. Now, muscles of the anterior trunk, shoulder, and the arm. Here we have the internal oblique. Okay, I want you to notice there's actually two different types of oblique. We have the external oblique. Oblique is at an angle. And so here you'll notice anytime you see these layers, always know that the outside is going to be external. Oblique is at an angle. Here you have internal oblique, so it's internal, more inside, also at an angle. And this internal oblique, this is going to flex your vertebral column and also rotate your trunk and bend it laterally. As this contracts, which side are you going to bend? You're going to bend towards your right side or you're going to bend towards your left side? Good, you're going to bend towards the right side. So this is going to shorten up, fold this way. And remember, as a reminder, because this can appear on both your bones and also your muscle quiz or also your exam, right and left always deals with the patient's right and left. And so this is going to be the right side and this is going to be the left side. Next we have rectus abdominis. Rectus meaning what again? We saw that earlier, straight. Here's this nice straight striations of the muscle. This is going to flex your vertebral column and also compress your abdominal contents. And so as these contract, you can decrease the amount of space in your abdominal pelvic cavity or abdominal cavity. And this is times when you're going to compress this during defecation, during childbirth, and also during forced breathing. So right now we want to go contract your rectus abdominis really fast, and you can notice you exhale with much force. We also have transverse abdominis, so rectus, remember, being straight. This is going to be that nice six-pack that you see men have. Well, you would hope to see men have, right, if they work out. And then you have transverse abdominis, transverse meaning cut this way, or this location going side to side. And so that's this most internal one if you see different layers. So transverse, remember, going side to side. And this is also going to compress the abdominal contents. Okay, finally we have external oblique. This is going to flex your vertebral column, rotate your trunk, and bend it laterally. So it's pretty much the same function as your internal oblique. But just be careful. Practice identifying your rectus, transverse abdominis, internal oblique, and then external oblique. Looking at the posterior muscles of the trunk, shoulder, and arm, we're going to start off here with our trapezius. And this is going to elevate, depress, abduct, and stabilize the scapula. Now as this contracts, we're going to bring up scapula. So bring up your shoulders up. And also can depress it. Deltoid meaning, looking at that, referencing that shape, or that triangular shape. This is going to abduct our arm. Triceps brachii, triceps meaning 3, so here's that 1, 2, and we don't see the third one in this illustration, but here we have the insertions, 3 insertions. Here we have, for triceps brachii, this is for elbow extension, and it's antagonist to our biceps brachii. So as this contracts, we're going to lengthen out our entire arm, or our elbow. Latissimus dorsi. This is going to extend and adduct our humerus. So bring it back closer towards our midline. Now we also have these different muscles that arise from the shoulder girdle and across our shoulder joint. So it's going to arise from our shoulder girdle, whether it's going to be our scapula and our clavicle, cross our joint. Here's that shoulder joint. And there's 3 of them. So we have the pectoralis major, latissimus dorsi, and you have the deltoid. So those 3. Posterior muscles of the trunk, arm, and shoulder. We have the erector spinae, iliocostalis, so that's one of them, longissimus, and spinalis. And all 3 of these are going to do a work for your back extension. And then down here, we have the quadratus lumborum. And this is for flexing your spine laterally. So contracts, and your spine's going to go in this direction. Anterior muscles of the upper limb. Now we're going to look at the biceps brachii, which is antagonist to our triceps brachii. So this is going to supinate your forearm and flex your elbow. Brachialis, it's actually a larger muscle. We just kind of see it as one muscle here because of our biceps brachii. But this is for your elbow flexion. And finally, we have our brachioradialis. And this is for your elbow flexion as well. It's a weaker muscle, but it's also for elbow flexion. Looking at more posterior muscles of the upper limb. Oh, we already went over triceps brachii. But as a reminder, this is going to extend your elbow, and it's antagonist to what again? your biceps brachii. Looking at muscles of the forearm, we're going to look at two different categories. Flexor carpi, which is for wrist flexion, and flexor digitorum, which is for finger flexion. Here we have the flexor carpi radialis, and so it's going to flex the wrist that's closer towards the radius. Here we have our radius in anatomical position. So it deals with those, or this area right over here. Then we have flexor carpi ulnaris, which is closer towards the ulna, so it deals with flexing our wrist down here within this region. Flexor digitorum superficialis. Here, flexor digitorum, we're going to flex our fingers or our digits. So as these contract, we can pull our fingers inwards. Okay. Now looking at the opposite side, so if we put our arms, if we pronate our arms, here we have extensor carpi, which is once again for wrist extension. And then extensor digitorum, this is for finger extension, so opposite. Okay, and so if it's an opposite, here we have extensor digitorum. As this flexes, we can pull, so I want you to flex, put your fingers towards the back of your hand, or the back of your arm. And so that allows, so as this contracts, you're going to pull your fingers towards that direction. We have extensor carpi ulnaris because this is going to be closer towards our ulna, where it's going to innervate towards our ulna. So as this contracts, it's going to pull our wrist towards the back of our arm. Posterior muscles of the lower limb. Here we have gluteus medius. And this is for hip abduction. It also helps steadies your pelvis when you're walking. Here we have that nice gluteus maximus. And this is for hip extension. Here we have the adductor magnus. This is for adducting the thigh, so it's even in the term, so adducts. Looking anteriorly at this hip joint, iliopsoas. So we have two, the iliacus and psoas major. And this is for hip flexion, and it helps keep the body firm from falling backwards when you're standing upright. It's a nice contraction. Looking at the lower limb, sartorius. This muscle over here. This is going to flex your thigh. And then we have the rectus femoris, vastus lateralis, and vastus medialis. So medialis is towards the middle, lateralis towards the side. And these collectively form the quadriceps, and this is for your knee extension. Looking posteriorly, we have the biceps femoris, semitendinosus, and semimembranosus, and these are all of your hamstrings. And then your calf muscle, what do we know that as? We know it as gastrocnemius. Looking anteriorly, looking at how we can move the ankle and foot joint, we have the fibularis longus. This is for plantar flexion and foot eversion, so going in that direction, putting your foot in that direction. Fibularis brevis, this is for plantar flexion and foot eversion, so same function as your fibularis longus. You have your extensor digitorum longus. The extensor digitorum longus, as you notice here, it's going to extend towards your toes. And so it's going to be used for toe extension and your dorsiflexion of your foot. So bringing your foot towards your shin. Fibularis tertius. This is for plantar flexion and foot eversion. So all of these, foot eversion, or also for dorsiflexion. Soleus, this is also for plantar flexion. And we have tibialis anterior for dorsiflexion and foot inversion. So bring your foot inwards. And if you can notice where insertion is. As this contracts, it's going to bring the foot towards that direction, and it allows your foot to face more medially. Okay, so here are all the muscles and anteriorly that you need to know, and posteriorly. Now, what do we have? In La Lima, you're going to have a list of all the muscles that you need to know for your next exam. It can either be multiple choice, fill in the blank, so of course you need to know identification. And so of course you only need to know the ones that are on your list. Now looking at injection sites, we have three major regions or three areas where we can inject the body. And the first one here is in the deltoid muscle, and this is a very common injection site just because it's very bulky. So it's common injection site. It's bulky. And this is for intramuscular injections that are less than 5 milliliters. And typically that's why we get a lot of our shots in this direction or that region. Another common injection site is going to be here within your gluteus medius. And this is for intramuscular injections that are greater than 5 milliliters. Now what's also common and very important to note is that here you never ever want to have an injection made in your gluteus maximus. And why is that? Well, this needle pierces through your gluteus maximus and into your sciatic nerve. That can lead to sciatic nerve damage. And why is that bad? Well, the sciatic nerve is going to be that nerve supply to stimulate muscles within your lower limb. And so you don't ever want to get that damaged. And so you want to always avoid injections to gluteus maximus, or else you can have damage to your sciatic nerve. And the last area that it's common to have an injection intramuscularly is within your rectus femoris or your vastus lateralis. Now with this is a typical injection site for infants who have very poorly developed gluteus muscles. So you can have rectus femoris or vastus lateralis, and also for infants who have poorly developed gluteal muscles. Oops. So that's a U. Now, one disease we're going to cover about the muscular system is myasthenia gravis. And this targets adults, and what it is an autoimmune disease, in which case the body starts looking at and targeting your acetylcholine receptors. So over time, you're going to have a shortage of acetylcholine receptors. What happens if we don't have enough acetylcholine receptors? Good, we can't generate that action potential. You remember, acetylcholine, that neurotransmitter, is going to bind to our acetylcholine receptors on our sarcolemma. What that's going to do is going to allow sodium to come in. If we have enough sodium coming in to change our membrane from a negative to a positive, and we have enough receptors that assist in this process, we're going to generate an action potential. The action potential is going to span our entire sarcolemma, and eventually it will cause calcium to be released and then our muscles to contract. Now, if you don't have enough acetylcholine receptors, you're going to decrease the ability for you to generate these action potentials and downstream for muscles to contract. So if you see people who have myasthenia gravis, what happens? Well, they'll see them with droopy eyes. They have a decrease in ability to contract these eye muscles. So droopy eyes. They're also going to have difficulty in swallowing and talking, and imagine how many muscles we're using just for this. And they're also going to experience muscle weakness. Now, what happens to people and how do they die over time? And so, really, death will occur from the inability of the respiratory muscles to function. And in respiratory system, we're going to see our diaphragm, also those external and internal intercostal muscles, all needed for this coordination of our breathing. Okay, and so that's it for chapter 6. I will see you in chapter 7.